when I kind of hit the wall, so to speak, I recognized my mental health wasn't good, my physical health wasn't good, and I didn't even know I was burnt out. I felt like I just couldn't do the job.
You're listening to the Soul Touched by Dogs podcast, the show for dog lovers who see dogs not as toys or tools, but wise souls worth our respect and care. I'm Anke Herman, and I'm your host. Alrighty, hello and welcome, Dr. Marie. I'm super excited. I really look forward to this conversation.
Oh, me too. Thanks for having me.
Well, if you've listened, I know you've listened to a couple of episodes, you know the drill. Let people know where you're based and, what's your business with dogs.
Absolutely. I am a veterinarian. I did my training in Western Canada, which is where I grew up. And after my vet school, I went on to do an internship and residency in the United States. And my specialty is emergency and critical care. So I work with the sickest animals when they come in, dogs that get hit by a car or have kidney failure or having troubles breathing, those types of things. They'll come and see me either in the emergency room or they'll be cared for in the intensive care unit. And that has really been my passion in my veterinary career. And it took me to a job at a vet school, the Ontario Veterinary College, also in Canada, on the other side of Canada in the eastern provinces. And it was there that I really, unfortunately, experienced a lot of burnout as a veterinarian. It was the first time that I really felt that this career that I loved wasn't sustainable. I felt like it was just not going to be possible for me to work as hard as I was working and do all the things that I love doing and still stay healthy and well as a person. So I ended up leaving that job despite really loving it and moving back closer to my family in Western Canada, where I really started to take a step back and look at the profession more holistically. And so, really, to consider, what are the amazing, wonderful things that we do in this profession, and why is it that so many of us are burning out and are having mental health challenges? And that has led me to a lot of the work that I do today, which is around mental health and well-being advocacy, and a lot of educating people about the profession and, of course, about taking care of themselves.
Such a crucial piece to it. I mean, well, there's so many directions I could go with this, but um, I mean, to start with, I'm curious. Like when did you know you wanted to be a veterinarian?
Yeah, well, I grew up with two veterinarian parents. So my dad was a vet. I guess they're still both veterinarians. They're retired now, but he worked in regulatory medicine for the government, so focused on food safety and animal welfare. And my mom owned a companion animal practice in the town where I grew up. So, my earliest memories are going to my mom's practice, helping out in the clinic, waiting for her in the office, and just growing up literally in practice. And I'll be honest with you, I don't remember a time I didn't want to be a vet. It just always felt like that was going to be the way that I was going to go. I have always loved interacting with families, with pet owners. I've always loved dogs. We had dogs growing up, and it just seemed like the right fit. I always felt like this was my calling. This was my chosen profession.
I love that. I love that. I guess it must be double hard then when you feel like, oh, this isn't sustainable, when you hit that moment of burnout. So how, like, did that come as a surprise, or did you see like your parents go through that as well? Or was that something that hit you where like, oh geez, I didn't see that coming?
It totally hit me and I didn't see it coming.
Mhm.
I saw my parents work very hard during their careers, which I think in some ways was generational. They're baby boomers. And, my mom worked very long hours. She worked some weeks, 6 days a week, and then she was on call and she would often be in on her days off or in the evenings. And I'll be honest, she never complained about it. I think for her, it was just part of the job. She loved it. She loved her clients. She was a great veterinarian, a wonderful surgeon. And so it was never really communicated to me how hard it was. Of course, I think in reality, the vet profession has changed quite a bit from back then. There's many, many more pressures on veterinarians today from, social media reviews and online reviews to just the sheer mass of information that we have to learn to do our jobs. There's increasing investment in our pets and our dogs, and we want to do more for them as pet owners than we've ever done before. And so, there's more costs associated with vet medicine. There's more desire to seek the highest level of specialty care. And so it does come with more pressures. I think for me, working in academia, which was a little bit different, of course, than general practice, I had so many different responsibilities. I had research projects, I had grad students, I had rotations on clinic, I had teaching in the classroom. And it felt to me like the work was never done. The shifts were never over. And it was really on me that I was taking on too much. And I wanted everything to be perfect. I wanted to do the very best at everything, which is a common trait, of course, among veterinarians. And so at the time, when I, kind of hit the wall, so to speak, I recognized my mental health wasn't good, my physical health wasn't good, and I didn't even know I was burnt out. I felt like I just couldn't do the job. I looked around, I saw everybody else who seemed like they had it figured out, and that I just for some reason couldn't do it. And keep in mind, this was, more than 10 years ago when we weren't even really talking a lot about burnout. And
Mm-hmm.
so it has really become my mission today to highlight what the symptoms are, to validate what people are experiencing, and to give them the tools so that they don't find themselves where I did and that they can stay in the profession long term.
Mm. I love that. Actually, I mean, it's interesting because like I've had my my experience with it with my first business. I had a sewing business, like total passion, and yeah, like a million. And the thing I always find, and now I've had clients who kind of focus on the burnout piece, and it's a hard one because people don't see
Yeah.
it coming, right?
Hmm.
Because you always think like you want to prevent it, but how do you prevent something that you don't? When I literally the day before I was like, okay, this is it. Somebody would have asked me how you're doing. Oh, well, it's busy, but that's kind of like lucky because, and that's just it, right? And I was so exhausted that,
Mm-hmm.
and I didn't see literally like, yeah, up to it like a day before I hit my wall. I literally thought, oh, well, yeah, it's a little bit too busy for my liking, but I should be grateful because it means business is going well, right? So I
Hmm.
did not realize that I was coming to a point where just, and
Hmm.
I've like anybody I've spoken to with a similar experience, there's always been that like, no, you don't sort of think, oh, well, I've got another 4 weeks until I crash, so it just hits you out of the blue. So how, like, what would you say to somebody who's in a position where you see them heading towards it, but they might not notice?
Yeah, well, that's the thing. Like you said, it's almost like you're a fish swimming in water and somebody asks, "How's the water?" and you're like, "What water?" You know?
Yeah.
I think really this is why it's so important that we're talking about this more so that we can, shine a light on what we're seeing. And I think one of the biggest things that we see in veterinary practices is when our team members are acting out of character, they might be feeling cynicism, like they just don't care about the patients as much or they're not as invested in the cases or they're showing up late to work or they seem distracted, overwhelmed, extra emotional, extra touchy, in terms of being more irritable, so to speak. And so I think sometimes we in life and in work we chalk this up to like what's their problem, I just don't like working with that person anymore. And I've tried to really create an awareness and understanding that this could be a sign that this person is struggling. And so opening it up with, as you mentioned earlier, this curiosity, what's changed for you? How are you feeling? Like, how are you really doing? Because these are the things I've noticed and I'm worried about you because this isn't like you. And so opening it up from a place of care and concern rather than judgment and criticism, I think is a huge thing that we can do for
Mm,
anybody in
yeah.
our lives.
Totally, totally. Yeah, I mean, because I think it is always easier for the people around, like if it's you, like everybody else will see it, but you can't, right? So I think it's really important to have those people who will ask those questions, right?
Mhm.
Now, if I'm imagining out of all the, vets I've dealt with with my dogs, and I would imagine that emergency care is probably the most stressful of them all, or the
Hmm.
most emotionally taxing, because like, oh my God, like I can't even see a dog suffer, like,
Yeah.
whatever. So in seeing them at their worst. So how did you get into that?
Yeah, I agree. It's definitely the most challenging, and maybe that's part of the of what drew me to it. In my internship was the first time that I had shifts alone as a veterinarian, and they were always on emergency. So it was out of hours when the teaching hospital was closed for other services, and I was a brand new vet, this little intern, and having to deal with all species, birds and rabbits and cats.
I've got your,
Favorite.
yeah.
It was amazing. And I honestly, I just loved it. I loved knowing that this animal could come in on the brink of death or feeling so sick with a family that is so worried, and that there were things that we could do to save them. It was really wonderful to see some of these cases that looked like they were about to die and that we could bring them back to life. And of course, yes, there were situations where unfortunately animals did come in distress or were suffering. And in some of those situations, we could, bring them back to comfort and health. And in some of those, we would have to make the difficult decision for euthanasia. But I just loved being able to help in those intense situations. I liked the challenge, I liked the unpredictability. And yes, it is very hard. All of those things together.
That's true. Like, and it doesn't mean it's, yeah, no, because I'm just thinking, especially in the context of the burnout, right? It's like, and then she goes
Mhm.
and finds herself like the most kind of demanding,
Mhm.
field of it. Um, there's something like I've seen videos where, like, like on Instagram or something, where there was a vet and he goes, the hardest part is like when dogs need to be put to sleep,
Mhm.
and owners will like, and I couldn't believe it because he said like a large vast amount of owners will just kind of drop their dog off. Is that true?
I wouldn't say a lot. I think it used to be that way. I in my book, A Compassionate Calling, I have a whole chapter on euthanasia, and it goes back to the very first dog I remember being with my mom with during a euthanasia. She came in, it was a day off. I went with her to help, and I didn't know that's what was happening. I was very young, and I was holding this dog, and she injected something into the dog. The family was not there. And then suddenly the dog had passed away. And I was sobbing. It wasn't, I didn't expect it. And it happened so fast. And I think back then, again, this was like, 35, 40 years ago. There used to be that sort of separation. You would take the dog to the vet and they wouldn't come home. And I think now things have really changed. Families want to be present. And there are so many incredible, even home euthanasia services where vets will come to your house to perform euthanasia. So I do feel like there's a big shift in how we say goodbye. And even in a busy emergency practice, we will have a nice, quiet, calm, dark space where families can go to be with their pets during those final hours so that we're not, sitting on that cold metal exam table, that's our last memory of being with our pet. To your point about the distress with euthanasia, it's one of those really interesting topics that I think a lot of pet owners aren't aware that absolutely it's hard to do euthanasia, especially when we're doing a lot of euthanasias in one day or in a week, especially when those are beloved animals that we have cared for their whole lives. Like sometimes our dog patients are 16, even 20 years old. And so that can be hard for us as well. We will grieve as well as the veterinarian. And there is also a deep honor and just a comfort in knowing that we can be that individual who can, like you said, take them to the Rainbow Bridge in a peaceful, loving, kind way. And so for me, when euthanasia is done well, when the families can be present, when it's peaceful, when everyone knows it's time, then it can be a tremendous experience. And research would actually suggest that it can boost the well-being of the team. Alternatively, it's those situations when families aren't quite ready to make the decision, or families are in disagreement, or the decision is being made because the family doesn't have the money to spend on the dog's treatment or the dog's surgery. Those are the situations where there's a lot of distress on the part of the veterinary team and everyone, of course, involved. And those are the days that I find really challenging when it comes to euthanasia.
I can totally see that. Boy, oh, yeah. No, I don't know. I mean, it's always hard, but especially if you feel it's an animal that wouldn't have to die, kind of, like, oh.
Exactly.
Um, I mean, that kind of brings me to another kind of topic I'm really curious about, and it's this whole there seems to be like a, especially maybe even when you compare it with your parents, when they first started, when I think in the older days, like treatments, veterinary treatments was kind of a lot of natural kind of and herbs and this and that. And then it was kind of like very much sort of pharmaceuticals. Like I see it here. It's like,
Mhm.
oh, the dog has something. Well, here's a cream and here's a tablet and here's like,
Mhm.
stuff this up your dog's like whatever, right? And so at the same time, at least in my world, like, with the people I interview, there's a lot of holistic vets, who sort of kind of go and find a way beyond the purely pharmaceutical approach.
Yeah.
So what's your experience? And I mean, is there a shift in where how this is going, and
Yes.
what's your take on it?
Such a great question and a great observation. I think the beautiful thing about veterinary medicine is the degree gives you such a breadth of possibilities and scope of practice. So, yes, 40 plus years ago, you had your general practice veterinarian. Very often they were a mixed animal veterinarian, so they would look after large animals, small animals, dogs, cats, horses, cows, pigs, everything. I don't know how they did it. I don't, they still do it in rural communities. In most of the big cities, it's very much small animal focus. But even in small animal medicine, there are specialties. There's my specialty of emergency and critical care. There's medicine, surgery, dentistry, and various other specialties as well. And for those veterinarians who really do value or have an interest in the holistic approach to veterinary care, which I think is amazing, we have veterinarians that can do acupuncture. They have, food therapy certifications, energy healing, um, you know, rehabilitation, physical rehab. There's so many different things. And so I do believe there's a place for everything because there are differences in how families want to treat their dogs. Like we see that even among I was going to say among humans, we're all humans,
It's the
but
same,
in,
yeah.
in caring for ourselves, some of us like to use more herbal therapy, traditional Chinese medicine before we would take a Tylenol or an ibuprofen or something like that. So I think it's wonderful. And I think it just really highlights the many, many different ways that a veterinarian can practice. And that for those dog owners out there, if you're feeling like you're not connecting with your veterinarian, just know that there are other veterinarians who practice in different ways that might resonate more with how you want to approach your pet's health.
I love that. And I do think it's very similar to our own approaches, right? So you can go and you get a doctor and like, yeah, don't. I mean, I actually think the biggest thing for me is always, well, do they actually listen to me?
Yes.
And that's not always a given, unfortunately, right? So sometimes you just get lectured or, talked over. And, and it gets worse because the dog, and if it's with the dog, like the dog can't kind of speak for himself, right? So it's kind of worse in that situation. I would love you to share a little bit about your book, right? So I'm always kind of, and a fellow author. What inspired you, with with all the busy work that and all the work you're already doing? So it's not that you're kind of bored, So what made you decide to write the book?
Yeah, there's a couple of different reasons. I shared my passion for this profession that came from a very young age. A few years ago, I came across this study that demonstrated that less than half of veterinarians would actually recommend the profession to others. And I was so surprised by this. This was a study that came out of the United States, and it seemed to be a more common sentiment among new graduate veterinarians. And I thought, how can that be? These are new veterinarians that are just starting their careers. This should be at the height of, their excitement and passion for the profession. And it seemed to me that there was this disconnect between what they expected veterinary medicine would be like and what they were actually experiencing. And so there was a voice inside my head that thought, in the name of mental health and well-being, education, and advocacy, they need a better understanding of some of the challenges that we experience, because it isn't all playing with puppies all day. Like, there's a lot of hard things that we do, and maybe they just don't know that. Around the same time, I have to say, especially here in North America, there really seemed to be a shift in a little bit of adversity, or what's the word I'm looking for? Like distrust and angst between clients and veterinarians. And of course, it's not across the board with everybody, but this was during the pandemic, of course, when a lot of pet owners were not allowed in practices, when there was a shortage of veterinary professionals that still continues in some places today. And then all of this combined with prices going up because the demand for vet care is going up and the supply is going down. And so there was a lot of sentiments among clients that were, frustrated with veterinarians, and this perception that veterinarians are just they're money hungry and they don't really care about animals, and these types of sentiments. And so there was a twofold goal for me. I wanted to really make sure that veterinarians and aspiring veterinarians could understand the challenges and the joys of our profession, and for pet owners to really understand the realities of what we do as well, that there is a crushing amount of student debt among a lot of veterinarians, that the salaries up until recently have actually not been very high, and they remain low amongst some veterinary team members, and that there's incredible things that we can do, and there's really hard things that we face on a regular basis. So my goal was, again, bridging understanding, empathy, and compassion for everybody who's interested in this wonderful profession.
I love that because it's so easy to judge, right? Without actually really fully understanding. I mean, like talking as a dog owner, right? So it's so easy to have a go at, at the local vet, without really knowing what's going on for them. So if somebody is listening to this, like if you were to pull out a couple of nuggets from the book, what are some of the things that you wish people and aspiring vets knew?
Yeah, well, I mentioned a couple of them. I think as certainly among veterinarians in the United States, there is a crushing amount of student debt.
Mm.
Very recently, the level of debt compared to the income has started to shift. But up until then, we had the highest debt to income ratio of any medical profession graduating, which means decades of paying off student debt, which is a big stressor. And we
Yeah.
know based on research that stressor does lead to burnout. Believe it or not, I think a lot of pet owners, really picture a veterinarian as having this amazing job, and everybody wants to be a vet. And, when I was young, you hear people say, when I was young, I wanted to be a vet. And I think they don't often realize all of the challenges that we experience, and that those challenges can take a toll on our mental health. So there's research to demonstrate that rates of anxiety and depression are higher among veterinarians compared to the general population. Even thoughts of suicide and deaths by suicide are higher among veterinarians than the general population. And it's not to say that it's vet medicine that is the cause, because those are such multifaceted and challenging things, but it's to recognize that we're human, we have our challenges as well. And I do think that those are important things for people to be aware of. And there's incredible things that we do. I think pet owners don't realize that, we can do dialysis on animals if their kidneys are failing. We can have them on ventilators, just like humans were on ventilators during the pandemic. There's so much more that we can do. There's so many different careers that people with a veterinary degree can have. It's wonderful, and I'm just so excited for that information to get out there.
Yeah, no, I mean that makes. I mean, I guess you don't want somebody, and actually that's interesting because I'm thinking like, why would I think it like kind of finding that surprise, that this isn't what I thought I'd signed up for. I think it's worse if that happens after studying, I don't know how long, right? I actually remember
Totally.
when I lived in Sydney, I knew a doctor, right? And he had, I think he was still kind of trying to go for his specialist exam. So he was practicing, he was working in a hospital, and he was miserable as anything, right?
Mhm.
Because he kind of was exactly like he started to experience like normal life as a doctor in the hospital, like long hours, pay wasn't half as good as everybody always thought. Everybody was like, yeah, you raking it in. No, he wasn't. He had these massive double shifts, and it was just really long hours, lots of admin, lots of insurance
Yes.
hoo-ha. And so yes, and the problem was like, if I have that experience and I work in a company and I work at whatever, and I'm like, oh, this isn't my thing, I'll just do something else, right? But when you've spent, over, I don't know how long the veterinary career is in the US, but if I've spent over a decade,
Mhm.
studying for this, and then like, okay, I can't just go and work in a different company, right? So
Mhm.
it's almost like is that is that perception like does that play a role that you feel like making a pivot somewhere else feels like even harder than staying where you are? So it kind of whole thing feels more like a cul-de-sac.
Oh, yeah. So you raised such a really good point. And to answer your question, yes. So veterinarians minimally have 6 years of schooling after high school. Many of them, especially those who become specialists, have 10 to 12 years of school minimum. And so to your point, it can feel like I've invested all of this time, all of this money, I have to pay off these debts. What else am I supposed to do? Like they really feel like there's no way out. And that goes even for veterinarians who have chosen to focus on a particular species or who have chosen to go into clinical practice. They feel like, well, I have to stay in clinical practice or I have to stay with dogs and cats or horses or whatever it is that they've chosen. And so there was a research study actually looking at those sentiments among veterinarians, and they found that those veterinarians who felt stuck and who didn't see a way out of their current job trajectory were much more likely to experience psychological distress. And so part of writing this book as well has really been meant to highlight that there are so many things that veterinarians can do. You can work in public health, you can work in industry with pharmaceuticals, doing research, teaching, clinics. There's so many different things that you can do. I think one of the other big pieces it's important to highlight is most veterinarians are like me. They decided they wanted to be a vet at a very young age. And then from that point, everything was about being a vet, right? And so veterinary medicine or being a veterinarian becomes their identity. It is how they see themselves. And so when that identity starts to come into question, should I leave this job? Could I even leave this career? There's this really unsettling feeling of then who would I be? Right. And so I think it's important for veterinarians to consider themselves as having a career as a veterinarian or a job as a veterinarian. But really, at the end of the day, they have a veterinary degree. And with that veterinary degree, there are many, many different things that they can do, not just working in practice, helping to vaccinate dogs and, do surgeries and that sort of thing. It can be many, many different things.
And that's so refreshing, though. I think that's just so much, so hopeful for people who kind of feel like, oh my God, what have I gotten myself into, right?
Yeah.
So, I mean, I don't want to, I'm kind of curious, but I don't know whether it makes sense to ask you because we'll never know. Where do you see yourself in 5 years' time? What do you
Oh,
see
I love
yourself
that
doing?
question. Yeah. I would love to still be practicing. So I, believe it or not, as stressful as it is, I still love emergency and critical care. I debated when I moved into well-being advocacy and wrote this book, I thought, gosh, is it time for me to hang up my stethoscope? I would like to get to a place where I can speak to big audiences about caregivers and the challenges that we experience and really advocate for mental health and stigma reduction, encouraging people to get help when they think they need help for their mental health. So really opening up those conversations and also continuing to do the work as a veterinarian because like I said, I love helping people. I love taking care of dogs and cats as well. And I can't imagine doing anything else at this point in time.
I love that. I can see a TED talk on the horizon, and I would definitely want you back for that. Oh, there's another book. Well, thank you so much. Like, where can people go and connect with you? And obviously, we're going to pop the link to the book in the show notes as well. Where can they find you and find out more?
Oh, thank you so much. Well, I have a website, marieholowaychuk.com. It's just my name. And I'm also on social media. So Marie Holowaychuk or Dr. Marie Holowaychuk, you'll be sure to find me.
Awesome. Well, thank you so much. This was absolutely delightful, and yeah, I think that we all kind of need a more nuanced perspective of what our veterinarians are doing. So, thank you so much for bringing that.
Oh, thanks for having me.
Thanks so much for listening. If you enjoyed the episode, don't forget to subscribe and leave a review so other dog lovers can find the show. Head over to soultouchedbydogs.com and sign up for the weekly treat. Tips, recommendations, and personal stories to warm your dog loving heart. And if you know a awesome human you think I should interview, I'd love an introduction. Email me at Anke, that's ANKE, at soultouchedbydogs.com.